Hello, my name is Dr. Pierre Brunswick. I'm the medical director at Helios Integrative Medicine. This is a review of an integrated approach to treating the symptoms of COVID-19 infection. My first recommendations are 3 pieces of equipment. First one, of course, is a thermometer. The second one, a pulse oximeter to help measure your blood oxygen level and heart rate. And the third one is for people who have asthma, which is a peak flow meter to measure your baseline peak flow. And my next recommendations have to do with supplementation that would be good to have at home. The first one is good old vitamin C, potently antiviral and an excellent antioxidant to help reduce the inflammation that COVID-19 infection creates. The second piece of advice is liquid glutathione, also known as liposomal glutathione. This comes as a pump bottle. It's 2 pumps, 2 to 4 times a day, to replenish glutathione in the respiratory tract and decrease the amount of inflammation in it. And then the next supplement is N-acetylcysteine, or NAC. NAC helps to replenish glutathione also, but body-wide. And this can be very helpful, particularly if you're using acetaminophen to help treat your fever, which reduces glutathione levels. And this can be an antidote for that. And then zinc. Zinc, 15 milligrams twice a day, can also support your body while you're helping to heal from the symptoms of COVID-19 infection. And then either of these 2 wonderful homeopathics. The first one is made by BHI. It's called Flu Plus. This can be taken anywhere from 4 to 8 to 10 times a day to help treat the flu-like symptoms of COVID-19 infection. And it's very similarly oxylococcinum, which is also used to treat the flu-like symptoms of COVID-19. So these supplementations, be wise to have them at your home in preparation for having COVID-19. Now, let's talk about treating fever first. I recommend that you keep your fever, if you get an infection, below 100.4 degrees. If your fever goes above that, you're going to be more miserable. You're going to be losing water and be more at risk for dehydration, and less likely that you're going to be able to take care of yourself in other ways. And so taking Tylenol or acetaminophen 4 times a day to keep your fever below that temperature is wise. Likewise, the previously mentioned homeopathics can also help with fever control. If your fever cannot get below 100.4, it's time to call your healthcare professional and let them know that your fever is too high. The second symptom that is important to talk about in COVID-19 infection is shortness of breath. This is a common symptom, and if you have risk factors for COVID-19 infection like cardiovascular disease or lung or kidney or diabetes, then it's important to know what your blood oxygen level is, and this is where the pulse oximeter comes in very handy. If your blood oxygen level is above 90%, despite the fact that you're short of breath, then you're safely convalescing from your symptoms at home. If it's below 90% oxygen, then it's important to call your healthcare professional and let them know that you may be having a complication from your COVID-19 infection, and you may need further evaluation. Similarly, if you have asthma and you're checking your peak flow, that can help you determine whether or not your asthma is adequately treated. If your peak flow measures below your baseline, then that's another reason to call your healthcare professional and let them know that you may be having problems controlling your asthma. And the next piece of information that's really important regarding treating the symptoms of COVID-19 has to do with hydration. You can tell very easily whether you're hydrated by how much urine you're making each day. If you're urinating 6 times or more a day, then you have enough fluid to make that much urine, and therefore you're hydrated. If your urination drops below that, then you're getting dehydrated. You need to push fluids or treat your fever more aggressively. If you're having complications with vomiting or diarrhea, which is causing you to lose more water, then please call your healthcare professional to let them know that you may be getting dehydrated, and you may need other evaluation or at least further recommendations. And lastly, please don't stop eating. It's important that you, even if you eat small meals 3 times a day of warm food, that's important to keep feeding your body while you're recovering and fighting the infection of coronavirus. If you have any questions about the recommendations in this presentation, by all means, visit us at our website at heliosintegratedmedicine.com. or call us at 303-499-9224. Stay well. Thank you.